And welcome back to Community Connections. My next guests are Deanna Eder, Director of Marketing and Development, and Leah May, Director of Outpatient Behavioral Health Services at Polaris Health. We're going to be talking about Mental Health Awareness Month, which is observed during the month of May every year. And so I first asked you when we were meeting a little bit before the show, when did this start? When was actually May recognized as Mental Health Awareness Month?
So this was started in the United States in 1949, and it was just to increase awareness around mental health. And we all face mental health, right? In one way or the other. So it was just to increase awareness.
Okay, and so has it become more important to have awareness of mental health? I mean, we've watched a lot happen in the past few years with COVID and so many people going through so many things, being able to talk about them. Do you feel like right now is the perfect time to have this conversation?
Absolutely. I think post-pandemic, we've learned to cope with things that we never could have imagined, right? Mm-hmm. And so to raise the mental health awareness of everyone in our community, and make sure that people are checking in with themselves and doing self-care and checking in with their neighbors and their family and friends. It's really important. And the stigma behind mental health, I think, has greatly reduced post-pandemic also, because we realize we've all struggled.
Absolutely.
I think one thing that COVID really brought to light is it's all ages, right? Mm-hmm. From the very littles to the older adults that really have been isolated in a way that those different age groups were never isolated in those ways before. So it's really become understood that it doesn't matter how old you are, right? That there's needs for mental health awareness and being sure that we're taking care of each other.
Absolutely.
But there always has been. I mean, we can go back and look at, years and years and different diagnoses and things like that. But the fact is when you have to live day to day, deal with everyday activities, not everybody handles them in the same way. And could be a variety of things. Could be how you were brought up. I saw a little meme on Facebook, and sometimes you say, oh, well, that's a great place to see it. But it brought the types of things together on how somebody's light can be put out. We all start out as equal young kids, but then the how they're raised, the situations they come through versus somebody else.
Right. And
they may have their light put out, and yet being kind and recognizing that and giving them support to, maybe it's to get help, maybe it's to have talk to somebody. A friend of mine once said that I think everybody should go to therapy and talk to somebody, because everybody has situations that they've come through and dealt with that may have packed them a certain way, and you don't even know what's inside. It's not like quit thinking of mental health as being crazy, which is right?
Absolutely. It's actually part of our physical health and our mental health. It all is aligned, and as long as it's all working good, we're feeling good, right? But if we have one little thing that goes sideways, guess what? It affects everything. It affects everything.
Well, now tell me what you do over there at Polaris as Director of Outpatient Behavioral Health Services. And I have to say, Palera Health is now, used to be known as West Yavapai Guidance Clinic, which, I love the people over there. We opened the crisis stabilization unit that, to me was a godsend for the community and for our law enforcement and for our community members. Yes. And so a lot of things you do over there, but what exactly is your position?
Right, so I oversee the outpatient services. We have 5 locations to serve all ages. We do have some that are just kids clinics and some that are just serve adults, but we have a Chino Valley office, Prescott and Prescott Valley, so we can see clients anywhere. And so I oversee all the services that go out of those clinics, and the therapists and the groups that we offer, and just make sure staying in tune with our community and what they need. And sometimes the needs are different based on where, right? Chino Valley may be having something prevalent in their community that's impacting everybody there that we're not seeing in Prescott Valley. So really being sure that we're meeting the needs of the community. Whichever location it may be.
When would somebody seek the services of Palera? It seems like it's always when you're in crisis. but is there an opportunity before crisis to seek services at Palera?
Oh, absolutely. I think that is what goes so well with Mental Health Awareness Month, because sometimes people don't realize they need help till it is a crisis.
Right.
And so now by bringing it of like, wow, maybe I could go talk to someone before I'm starting to feel like something's not going well. We get a lot of parents who are just feeling really stressed and challenged and don't realize, well, there is help for parenting as well. You're going through a lot because your kid's going through a lot. So once that awareness comes out where it's like, okay, I'm not crazy, I'm just having a really hard time, and there's services for that. Or the older adults, we were talking about the senior peer program. I don't know if you want to speak about that, but before it gets to a crisis situation. But a lot of people don't realize that. And so doing this outreach is so important so that we can really support them before. And then, of course, during and after.
Just yesterday, I shared a post on my personal Facebook page about our event that we did last week with the movie My Ascension. And I had a young woman who I knew grew up through the system or through the high school program over in Prescott reach out to me yesterday, and she's like, "I need services." So I put it out on my personal page, and she's like, "I need something." And so I gave her our information, and she's calling and setting up an appointment. So it's just reaching out one person at a time, truthfully.
Right. Not being afraid to have the conversation, which is what you and I talked about.
Yes.
Not sweeping things under the rug and say, oh, it'll be okay. You know, I think our young people, well, our community as a whole, through the pandemic, have experienced something like never before. And so to deal with that moving forward.
Yes.
And how do you get back to what our normal is going to be? And maybe talking to somebody helps you get to that, what your normal is going to be.
Yes,
You know?
absolutely.
I don't think people really realize the importance of the human connection face to face and in person.
Yes.
It was so great at first to have the Zoom and all of the things to keep us connected, but the more that it went on, I mean, it just feels so different to be
Yes.
in person and connected, and I don't think people really understood that in the same way that they do now.
Well, it's interesting. We have graduations coming up this week, you know, with the Bradshaw Mountain High School, Go Bears, Chino Valley, all of our high schools. And those students started out a normal school year, spent 2 years, 2021, in a COVID-type situation, and then came back for their senior years in somewhat of a traditional school year. That has got to be the weirdest makeup of their educational high school years that I could have ever imagined.
Right.
You know, start out normal and somewhat on the normal traditional way. And so, again, real quick, you mentioned services from youth to
End of life,
parenting
yeah.
to seniors.
Yes.
How would they access any information on those type of programs?
Sure. So we have a couple different things going on. We have a crisis stabilization unit, and that's in Prescott Valley behind Tractor Supply. Anyone in crisis can walk through our doors 24/7. Doesn't matter the crisis. You can call our phone number, 928-445-5211, or you can go to our website, polarahealth.com.
Okay, Deanna, we could have a conversation for hours on this. Deanna and Leah, thank you so much for joining us, and I look
you.
forward to, thank you for supporting everyone out there, Mental Health Awareness Month during the month of A. Let's help all of our friends and neighbors and family. Thank you.
Thank you.
We'll be right back.